Hi, everyone. Welcome to this virtual workshop with UAMS, University of Arkansas Medical Services Northwest Community Health and Research. My name is Diana Dominguez, and I work at the Fayetteville Public Library as the Multicultural Community Liaison. Today, we have partnered with Amy Riklon from UAMS to provide this virtual workshop to inform Marshallese community members about updated COVID-19 information, preventative safety measures, as well as information about the CARES Act. What we'll do is we'll start off with a presentation by Amy, and then we'll have the last 15 minutes for kind of questions and answer. If you're watching this through Facebook Live, we welcome your questions through the comments. If you'd like to just leave a comment below, and I can just feed those questions directly to Amy. If you're watching us through the Zoom chat or through Zoom registration, feel free to leave those questions in the Zoom chat and I'll present those to Amy at the very end. Prior to getting started, I'd like to introduce Amy. Amy J. Riklon, RN, is working as a Marshallese RN for the Healthy Start program for the Office of Community Health and Research at UAMS in Northwest. Ms. Riklon is a registered nurse. She has over 5 years of interpreting and community outreach experience. Ms. Riklon is currently enrolled in a BSN program and plans to pursue her master's in public health nursing so that she can continue to contribute to the efforts of improving the health of her community. Ms. Riklon is bilingual in English and in Marshallese. She's an advocate for research and programs that address health disparities, particularly the policies, systems, and environmental factors that affect the health and well-being of the Marshallese community. So thank you so much, Amy, for joining us today. I'm really excited to be able to have you on here, and I want to go ahead and open up the space for you to go ahead and share your presentation today.
All right, thank you, Diana, or Deanna, I'm sorry, and Fayetteville Public Library for giving me this opportunity to come and speak on behalf of UAMS, Office of Health and Research in Northwest Arkansas, as well as for the Marshallese community. I am going to be presenting in Marshallese, and I will go ahead and introduce myself. Diana, can you hear me? I'm so sorry. Hello?
Yes, I can hear you.
Okay, I'm sorry about that, folks. Okay.
No, you're good. We can hear you. Thank you so much. Yeah, you're good.
Okay. Kalau perangan oleh terleng cerita dan technical difficulty dia ya ko wajangan oleh ya ko mudada inan kamolo timero jilang nodar chala ke eu iman minodem che nan kamolo legan noru me jmor para ino dengan kile mane de war biro jaro ala baro im parkile kene wari lo mayon tata parkile mencaro ko kacojo utaje na wan malak wodagan kanono gan tabi ko an rainin Iran chola ka upper karere alang ni jawar lagin nana cipcume alkanono rajalet mana dinar. Not bar kia chola per welu ne coba man algaratan karwetok connection yo. Agatain Amy Rugelang im ngai charbal eno chua nurse ilo UAMS. Mewar chicho program go human Obijan Community Health and Research ngai pokona ye. The healthy start. The charbal pen rubororo. Imi bar charbalilo chedia ni charbalilo klinika wan no street klinika me charbali pen adan kenangan mi roan ai adan eno gara penangan mi nai plata nangan mi jim tangal barai not chedia ngai bar pokona lo family medical clinic igaran kamolo le UAMS Obijan Community Health and Research ilo air kar kileo poin podo presentation yo ngan jugun perinari lo Northwest Arkansas para inua dengan kacojo rumayal iwalagin agil iligan argan join kamol ngan roim rajalo im ngan ro repartunin ya wewat rainin adan malalawa ini kanono kakilo rainin tacar balagap sibangko an UMS ngan jugun perin an rumayal ilo Northwest Arkansas ni barpodok chat malalawo ikichen COVID-19 ni jabar kanan nampago ari ikichen COVID-19 rainin imta charbalaga magdugdugan Obijan Community Health and Research ilo yen inin COVID-19 impar kanano chirekan CARES Act nan moda ledop chirik malalagan UAMS UAMS University of Arkansas Medical Science ngabat Obijan at Palo Payville mission yawan UAMS akatabareo mission yawa dengan kagaman manlak ejmeur chigen lela ka ejmeur go yime ejmeur yo yamman ngan ro yim recho go ilo argancho yim ngan olben amerikain kap talagin lalin Fiji na ketanageo chit kaya kay ilo 2029 UAMS na pagman ilo chuanyan state go yimelaban ejmeur ilo amerikain ilo charwali mekada koan ilo wawe nan charwali ilo kliniko impare nuat charwali in research go aga im talgoan value immengo rauro ki pen UAMS retama ilo charwali ilo mol ilo kaude charwali pen elang kai narame chen lalgo kachoyo ime chalak kali jagala kilo lela kay jmaur ay bar charwali pen ron charwallo chuma im chechet im charwallo kay baro chalak perwi ceblukun payilo adan Zoom ngai kacheng chula menanga meroj pinit selai dia komo chala pun Obijan Community Health and Research Ichonya no Obijan UAMS ilo Payville imrej naidan OCHR chedian jiba OCHR Community Health and Research imechonya no video alaban kamanelang on manla gigichen ejmur im charwalgo ngan chugujugun peri nari lo arganjo Obiji near ichino ilo 2014 imegar chinogan rally the grijarwal akia ewer elapala gajen lemangul team member elengyan program go Obiji ne jabar pokona area eno daer charwali pen chari grigro charwali pen rubororo impare not program go chedi kitchen out food ilo kemi me jalak emarong emena wale mia emo dalak ijen loan timin pello menjaro lair kamani charwalin outreach go no kay ikijan lo air kamani health screening ko no da air kar kagalgal kamani kagalgalin nangan mi jinay pladum tangal imchenod menin rallo kay ala bay guji chen way wininam imitama kunin nan kar chudak no street clinic paran marong cibang rumayor rowet ilo rumayor rowet ilang air nangan mijin ay pladum nangan mijin tangal elatada ngan rome chalagay rinchuren in tarda parinwad ilogar chinon oga jemo jangar palak chicken ejmuran karay ilowanot clinicin yimnge wai gu jam appointment koni kole to contact nambayo ini bello jamlagin presentation in jenot kachojo program gainim air charwali penchu jugin perinat ingin buen katabarewan o CHR pues chen kakaman manlak ejmurewan kachojo arnit charwal gain cheno CHR rejuan malagot pada cheno nangan mijin COVID-19 emui ugo tadan wawen kamani charwal gain ngeba wan chongok ilang chichu yan ru charwal adan charwal lo mo moyer aga yeba lang chadar charwal lo bigin im program go igichen mangai emo jugot enot focus go enot galat kachem chibang chabarot pamle go iloer nangan mijin chelader enot komigi jallo program ngai mere na jadi pamle ga in me yan der pag nangan mijin COVID agre quarantine chikijen parpada na ripene mi aim e kamilo archibam ichen mangai im aga par muda jena on mala godum par kamalele chiri go takom kamar merwano bigin inai kamalele ko kajo jikan nangan mijin COVID-19 tain COVID-19 itun kiyo yagal yo jajeret jenarme janganarme ijbar naidan novel coronavirus ewi wawinan ajeret novel coronavirus ak COVID-19 roret ti jamalagilo chigine jme urgo rajakada got ken wawinan ajeret kijin kia chichalaw tage ijajeret iloar tago rajwala gilo anchuane nangan mit pobe wakamaje ilo ay kada narame royal bayre bageron tarin chongan na chijinonne imiloan am chigwe ijogo ak chabarod mergo e work yini imilo am chigwe long ima podum agam mejam ingkan menin awro go kon kwalpe human rongul chagan elgunam chiwi ngeba counter go aga ken kabala kajam go aga light switch go immoda jena mangayam imende na uro go pandu dipam ga enyo ikutu dam kwalpim olivien nge chalak chobum deni ijo terem onai da lewat hand sanitizer go ta kakalego eno daga ilo chino nan gar wal nangan mijin eno daga chicho daga kakalego char kile chino nan nangan mijin wal do char chalagan pyogo piwa im kachinak chala puede kun nakachang kamagdi screena ya wartu wachenche par kakalego chet I'm sorry, Diana, can I have the screen up there without all of this? I'm so sorry, everybody.
No, yeah, it's okay. What you can do is go to review or slideshow.
Right here. There you go.
There we go. You'll just have to go back to where you were.
Okay.
Yep. Just want to let folks know that those of you who are watching through Facebook Live, if you want to leave a question for Amy in the comments, feel free to go ahead and do that. If you're watching us through Zoom as well, if you'd like to leave a question in the chat, we'll feed those questions towards the end of the presentation.
Okay. All right. Thank you, Diana. I'm sorry about that. Okay. Madaga kajangar pajaragalo kagalego. Yem kakuba bailo kagalego me mayan gar CDC warkar weto. Karbisan yem mantak kecetian barkagalego jego bar lalilo nangan mijina kay. Ngako jeng jaga me mo ngay natak param ngay pon podo mako jurur mako malangalang me mayalak mayalakot ngay natak loje yem putpiroro. Keme me boy elang okotakin kat adan kakalagin ray walangan kajujo arame jim emarong pagrualangan chongole men ran nganam eng jaga kakalagin aga ngakoy kilege et peripam jonian kakalagin yoko koni chibarak komarong ni kole chigine jimuro aga ngay bay publiga komarong bar kole mlale tayo komarong kamane chigen takdo. One roy biro air pag nangan mijin COVID. Emay kale karge cinchinon ga rutoro jen cinchinon wala air lengalak. Roy ora air nangan mij go ipere no chorenin menono ak air im nangan mijin tangal. Roy mayano en punir impiro do air gawilo nangan mij go rej adan akararo rej pororo. Yung nangan mijin porla. Yung public health rajang boy arami jaro e warair nangan mijin rola baka wadada nge adan ren narongan perod moyo yung katola ki jogo ilang arami ray ko bay pendoni. Nada ko jay wike bak takata nge war kagale ko rola ban COVID-19 itam makajalangan chicken takata kakale ko rola proje inuat kachina abang menono cap camala madakan madak imair ubom ngegel ancam marong cimayan kolman lakijan imngai piola tia magat terin nejam wilo yenirin kerlak nambanet 911 ngoko jangan jaga cuan ak royan kakale gain kolen 911 kemi me boy gue par kacala di rejaro karoan emergency ko gue rencala ke warnangan mijin COVID di pemilo air wo jim cibare ko cibang. Kamani jo konam ngan pobrai ajere din COVID-19. Ingin ko yelo tagay kansala de are kwala ke guna oro ko kaya ngini pendoni charbali pendoni lo air kamani lajara koan iti adan public health laptala CDC no taga kaida line wire ngin jejeloga olibien pelo lovely kana mask ka me yoam taga tijino ne kadam parrochet pine jelongi mak podo miluyen majem pego udah pare dale nurio male bran kainan arba adan kon barche ke temperature alale ko bi ba ke Ngoko yang jangan kacinak ngoko yang jangan pio. Min ko kuin parelang parcet ko jay ko ilukun. Kagalen ebo kon chala ngay. Ewar cirigan aga ewar cet kagalain. Adan jangan mijinit tam. Parenut ko ay kakudugutan kwalpem. Ceperi jogo ebo arami die. Emene kudugutam karrewi jogo roton yalatada kan disinfect kain jarbalo kain karrego me disinfect wai bom sporego yalatada i jogo alavam chibuim enot counter go yon counter go cell phone go computer go jabro meno me o chibui kajarbal kain karrego me rajabar mana man kich ak disinfect wai bom spore Jeberia ilo nambago an COVID-19 rainin nadan muda jana lewa nalala ko kar walo dokia re ni ba lewa nambaga mer nalala kin rito ko jen publikao lewa chenagar ebro rongole men raneo wangan jabatan paradin jon raneo emo jagar teje emen taujin radin jon pugui rongo radin jon romayo im jon taujin rali dak chongol chilu im yer meur jenangan mijin aga pata adan chilu bugu radin jon lemen jen chongan kei gain rej ajiri rome redi gala jen chongol rali dak ya nge bai contact sim nge ejimu ya par lukun bugi malalaga contact langan positive case in COVID go total 2000 rali dak 4000 rali dak adan 4000 rali dak bugi yang chijino yang kia chen kejana me kia me reba public health report tok lo karadin jon raneo active case of Q1 tracking another then ada lewat jinule men arme imilo then household go rally dak rome urgent eno to ba chente de rana kai jon taujin rally dak pugui chongol chilu imngan rome retrage chen jinule men mai e wal ke chongol radin jon yae rej maina raga yogo an rejugo im chonyan rally dak chonyan adan jan rally dak ai chonyan menchogo gai rej partrage im rebachen Pocahontas im jet jen par Springdale aga ilo terrain e chalagyan county go par jet rej trage rum e chalke go nganan namba gain wal imil ilo air chalagagi aga kijeloga namba gain rej walala pata lukun rajang ako par CDC par rajang pagkajoyan kachiongan rebijim kaya para ko nambagain po ella labot kay lo state in lo argancho echabi pero rumaya la par pen par rochet pata emaron par chelet kay ngay chichabadan on malagodum kay baro yem kajoyan ni par lore kay talay na kay michalaka lori iloar kanang mask ko chablukun perijo ijo me gunlang arame jie yem kachiongan kaya baro ben pobrai jenan ajere ro poi eno ka kajan chala ka mnyan chino war chugul ga chudure wigna na ajura oi pelo chugul chep ajura oi jota par university ga mjer chino chugul yem flu season na iman meno ko kain un na erba megar tangel gun walalak nambain ka chego yulukun reberem ka chem kaya baro iloan ko COVID-19 ajere ilo argan join chichugo to wawen go ragal ngan tabar chugujugun pergo chichar bali per ilo ar perbero tum char bali pen rispen goro imrumaya ro ilo chugujugun perinar ilo Northwest Arkansas magdugo ekarangan COVID-19 Kota ko mo inar kamani charwal ko ar rainin elegun COVID. Pada etche po jaragar charwal ipen community naroj. Imeja longot program ko im akan charwal ko mcibang ko ci kamani ngan family ko kacho choron tanga ci per mo ko mo jediar. Aga cincino nan kar chala nangan mijin COVID-19. Ubiyin al kar kacem karwe elang melale ko igicen nangan mijin makar kacem charbalo dipen community ilo chabret wawain. Ngebat programan healthy food emejer ugote focusem kamani elang kain charbalo ko ilo er cibang family ko mem nyanchal nangan mijin chalader. Nungkem jar kamani Chuan opportunity nga nair katuk ibang kitchen mangai madar deliver lak mangai ilang chuan survey yo mengan rome rai bu ibang kitchen mangai rekan nem ilang yan lo bijin ibang deliver lak mangai ngan family yo mer rek nyanangan mijin chala der nge wachet yan program ko nge wach healthy start talage ikijen lang yen raja outreach peri pen ranangan mijero age lo tarai nge yo tak kia air charwali pen client air ino to kaya rala kanono kami di pen rone ilo meja to da talabon pada bilo klinik ote pala bot klinik ilo air par charwali pen ranangan mijero roro imparche to ko kain akan charwali kamani ala bangan community nar no to kay emijar translating kamani olip charwal ko emijan kaman chubui chima kain ka ko ilo kajin pelle Spanish akajin majo ilang par ilang video ko rongo chima video eno to kachala ilo pelle kajin majo ng Spanish ilo tabigin kanya kana mask ilo ar katola karon ilo ar quarantine ilo in isolation imelang parchot chat tabi ko me kichenot kata kogan COVID ilang par chongo lale mem pallang alak public service announcement ino daga kachala ko ngalelangan Arkansas Department of Health at Public Health nganer lelang melale ko ikichen COVID akada ko ikichen COVID ngan man pawo ilo Arkansas chedian ijo ko chik par pagum pagchibang ko per ngo ko jalo kay royan listing na janay MEI may come chedoro may operate by Romajo Timeware partner ak charwali pen Northwest Arkansas Food Bank kay food bank ay supply dito mga ako nganar merong Kajarwal Ozark Regional Transit apajawan company nganar lela kempong mga ako ngan family ako rakar positive akaranangan mitchenot COVID ilo pugo no lo county ko an Benton in Washington County lo olipui modela karchino charwalin karchin alung ko mo talak jala ke elang yare ngar volunteer mchibang ilo elang wawaini milo ar karpada na ripen pare MEIM chuanin program aga agan yamay kaboje chuan chen ngan chibang yamayan kar Walmart toni di dop chuan kren ngan obigin yam komi obigin at pada na ripen Arkansas Community Foundation rar ko bay pendron charwali pendron ilo air kar chibang ledak chibang go ikichen mangay ilo Northwest Adan County o me Benton County, Carroll County, Madison and Washington County. Chenot menin rajalo kay kananagar warinangan mijin COVID ejalat elang arme family imraluji charbal wire egilag munchuguro Imilo air Katak Kin social distance rai chino garpog melalanim chino. Patola ronim chok kaman gathering agi penron ilo ar kachong dan kanceni aga kaja baro jena na jere nangan mijin. Ilo ar charbali pen abang kain UAMS tabar rolulu gochet ilo chugun perio ngan melala kan ai bujugo rainin ngan cibang wen worot mangai kalabalak cibang ko ngan programin outreach ko an mangai ilo yenin mit pogum lelak melala ko ole pui kilo newsletter ko im lelak melala ko ilo chicken wo rajalelak cibang kancen talang rajai buji par programin emenyan kar project karchenyo maji chen kar majo imelang rolul ko programin ar narong lelak cibang ngane ko bangan mencukul ko ngan cibang programin mangai ko an rejukul eno dan par walak chunyan dinin wan malagam caraman ngan kami ni na chujugun perina rilo arganjo ikam emnyan par pantingin jen dan programin kamane chuan air food pantry emujer kabalak chicken aji mangai inan perilo amerika ina alang wala kilo gar kajarbal chenin chibangin Northwest Arkansas Equitable Food Response and Relief Project. CARES Act Katak Coronavirus Aid Relief in Economic Security. CARES Act karpeji pen Congress imarchay neno chuan kagiene ilo mayo ilo Julayo state wan arganchay karapruwi $1 million ngan poparai COVID imcharbalagoan contact tracing ilo Northwest Arkansas. UAMS im Northwest Arkansas Council yo taliman lo charbalin yagoba jadian patana roayer im chicken tagadogo. Charbal CARES Act emnyan kabojet funding ngan kabojatan charbalago ngan air merong air tok bilingual health navigator imemit air jet jadi air ilang bar bilingual contract tracer jenot atan CARES Act imen ikaman malagot wawin kanono go ipen population go ar im jenot CARES Act inagay ikaman way en war kanagay tijelo gay alang war adan rumaya repello puji jenagay nagay eji bangala kilo air ni perilo community im kanono ipen army reinarim cibang gichen tagoroni kamane ngan pobra ngan kaya barokan nangan mijino im ilo chala bar air road charbalin bilingual navigator im contact tracer ngan romere kapwire charbal pai adan kwalake kami me air road im padap charbalin gay ijudogot ilo temporary echa badan permanent ilo terrain agay jatan full time hours yung mga kwar togilom limunam kanan apply marong kanta ke to kunampayo agi email to ka ilo ergan presentation ni wala ngelang kachida par chabrot kachida chojum par leto man ingini patana roar chen chino nar charbalilo areng kacheng chelmai gi nangan mijin ejelat community nar yung ngelang kachida niledo ilo email aga call to kunambana ilo presentation ni
Thank you so much, Amy, for giving us that information, just updated COVID-19. as well as some like preventative safety measures and more information on the CARES Act. I wanted to go ahead and open up the conversation for folks that are watching us on Facebook Live. I'm going to take a quick peek. I don't think we've had any questions come in so far. But if we also have some folks that are on the Zoom call right now or on the Zoom meeting, if you'd like to ask a question directly to Amy, you're welcome to do so now. You can unmute yourself and put on your video so that way we can hear the questions that you have. I can ask maybe a question just to kind of get us started off. Amy, what do you think would be some of your kind of main concerns that you see? We talked about this briefly right before this presentation, but what are maybe some concerns that you might have when it comes to COVID-19 and how it's affecting your community, the Marshallese community?
Yes, I think one thing that I can think of is the need for our community, how they were affected by, poultry workers that were affected and impacted by this COVID-19, and trying to get back to life and trying to figure things out. And I know that there's still things going on where they're still needing the help financially and things are still hard for them, and trying to get back to their normal life. I think if anybody else, like Dr. Riklon, if he wants to add more, I know he might want to add more on this.
Hi, good evening, everybody. Great job, Amy. Thank you for the presentation. Just wanted to add to what you mentioned. I think the Marshallese community definitely has been affected a lot by this pandemic. I think we've already had our struggles to begin with before the pandemic. We've had to kind of reach within ourselves and others and our partners and, collaborators and many of our, community partners. And it's been great to everybody to see everybody working together with that aspect of it. We have the real daytime needs, in terms of, food, in terms of utilities, housing, all those kind of things. And, health continues to be a challenge. And, I think the other concerns is basically, what's going to happen in the future. We know that, that the new normal is not going to be the old normal, that there's always going to be something different that's coming up. Unfortunately, for many of us, we still have our struggles in terms of health and chronic diseases and access to care, or at least increased access to care. I think what UAMS has done so far, and some of our partners, including Community Clinic and others, in helping increasing that access to care is great. But, I think we still need to kind of move on that, including with the federal fix and having our COFA and Marshallese community be eligible for federal Medicaid programs. We know that, this is what we know of Corona today. What's going to happen next week, tomorrow, next year, the next, few more months down the road, we don't know. How that's going to affect our health in the future, we don't know. We just know that it's going to be more challenging. So, we just need to make sure that, and just reiterate what Amy said, we need to continue to follow the guidelines. We need to continue to, make sure that we protect each other, we protect our families and our community members. And even though the numbers look great, this is not the time to stop. We need to continue to do our best and, continue to follow those guidelines. But thank you for letting me take part in this, Moldada.
Yeah, and I'd like to thank you so much for highlighting a lot of those points that you made, and Amy as well, like particularly just the impact that COVID-19 has had on the Marshallese community in the area, also in relation to the poultry plants, right? And even just pre-existing, health disparities or conditions that existed for the Marshallese community members, Dr. Riklon, that you mentioned. I know within Spanish-speaking communities, within my own community, we've been seeing a lot of efforts of folks teaming up with like local businesses to also pass out information that's in English and in Spanish, and making sure that local businesses are also adhering to CDC guidelines. And so what do the efforts look like within the Marshallese community in terms of maybe even local businesses or organizations that can, so that way people know that, you know, UAMS is a resource as well, but what are some ongoing, you know, collaborative efforts within your community?
Thank you for the question, Dan. I mean, definitely, I'm in the same similar situation with the Marshallese community. You know, I think, you know, this pandemic has made us realize that we need each other more than ever. And, you know, we have our cultures and custom in making sure that the families well taken care of, especially our elderly population. We do have Marshallese businesses in Northwest Arkansas, which, you know, many of us, including UMS and Community Clinic and other local partners, including the nonprofits of ACOM and MEI, our Consul General's office in Springdale has reached out to different parts of the community, including our churches, because church is quite big in our culture as well, in making sure that people work together in mitigating the spread of this deadly disease. And I think that's important that we still follow those rules, and we try to educate. And many other things that UMS done is not just us in UMS, but it's been in collaboration, partnership with others, to making sure that we can, as much as we can, reach to different parts of the community wherever they are, including Jonesboro and Northeast Arkansas as well, or even in Southwest. But it's been challenging in trying to reach people in terms of where they are across Arkansas, but at the same time seeing the partnership developed and enrich and grow. It's been great, because those are real challenges, and many of the things that we see is it's not a temporary fix, but we're hoping that whatever we do today is going to make systemic change for tomorrow, because I think many of these things that we're faced with in terms of the challenges have always been there. It's just that COVID-19 has put a magnifying glass that we actually now see it, and everybody can realize, oh yeah, that really is a big problem. And it's not just the in-language material, and it's not just the contact tracers and L navigators. Those have always been in need. So it's more making people realize that it's not just us, that we need things to happen for us, but things gotta change within the different systems and institutions for this to be a lifelong process. So hopefully, that's something that's going to be addressed, and hopefully that's going to be something that is going to continue for many years to come.
Okay, that's okay.
Yeah, those are all really, really good points and considerations to make when thinking about how COVID-19 is going to continue to impact our communities beyond this kind of like standard time that we're thinking about, when we know, it's not even just in terms of like health, but also relationships, right? I know that there's been quite a number of, unfortunately, casualties because of COVID-19 that has hit the Marshallese community pretty harshly. And I know in conversation with some organizations, the conversation around mental health has been talked about too. And I was wondering if maybe you all could speak on that as much as you feel comfortable to speak on. Because I feel like that might be a component too, that oftentimes when we think about COVID-19, it's thinking about maybe directly like those needs, like food, making sure that people have food, making sure that people have shelter, that, people are able to pay their bills. But then there's also this like, psychological component that's also affecting our communities. And that's also what will have a pretty long lasting impact on our communities. And so, yeah, I'm not sure if either of you want to kind of chime in on that.
Amy, you want to give it a try?
I'm gonna let you do that for us, so that
Okay, I'm on. No, good points, Diana. I mean, definitely. But we all think of mental health, and the challenge for us, and it's real life challenges. For us Marshallese and probably other cultures, we're very private people. We don't like to come out in public and say things, whether it's for boasting or whether it's for something that's negative highlights. But yet, those real challenges in terms of food insecurity, paying the rent, paying the utilities, and paying the medical bills, those add to the mental health challenges. And we're not just talking about anxiety, we're not just talking about depression, but it's basically your mental health basically affects your physical health. It affects all of your health. To me, health is not just physical, it's not just mental, but it's also spiritual, it's also sociological, financial. It's basically everything that affects that one person, whether it's physically or everything else. So that definitely, presents many challenges in itself. And, I think, there's been some cases or reports of cases of, people actually committing suicide during this time of pandemic because, of the stresses that, they've been feeling. Similar to the Marshallese population, maybe not in the terms of suicide, because, we've always had that as an issue in mental health, pre-pandemic, but definitely in terms of how do we deal with it. And for us, at least culturally, you were very close with our families. And that in itself is therapy, in just talking your heart out and, what's bothering you and what you're happy about, and, what about tomorrow? And so we're always taking care of each other that way, just talking to each other and trying to find solutions to today's problems. And that kind of helps with the therapy in itself. But we also know that we have elders. We also know that we have friends. We also know that we have doctors and therapists that we can reach out to, and we definitely have our our religious leaders, our pastors, and our deacons and deaconesses and all that. So we can reach out to them. But it sometimes is because we're so private, we don't want to reach out. So we just kind of not say anything, but that's part of our culture. But at the same time, it helps just talking about things, and even just sitting down and outside your porch or in the backyard or front yard and talking with that one person. So for us, it's incumbent about us who don't feel those kind of things to actually ask how that other person is doing. When you realize, and we all feel things. We all know when somebody's not feeling well, and you just ask, are you okay? What do you need? Are you, how can I help you there? How can I be there for you? So, but definitely mental health is a big thing that we all, should make sure that we're aware of it, and we should make sure that, we take care of it and talk about it today.
Yeah, thank you for going there with me. I know that's kind of like can be a difficult topic to talk about. And I know within our own community, like the Spanish speaking community, there's still a lot of taboo around mental health and like, why should I go to mental health? And there's like these ideas of who is, yeah, there's even certain language that we have around mental health. And so it's really good to hear from your perspective, and from other folks within the community too, that, that's being taken into consideration, when thinking about like more of a holistic approach to kind of addressing, disparities that exist across our communities. And of course too, I'm glad to hear similarly that there's a communal aspect there for both of our communities, and that oftentimes that ends up being a space that's very therapeutic and for us. Is there anything kind of coming to 7 o'clock? And so I didn't know if there was anything else that maybe Amy, if you'd like to add on, or Dr. Riklon, any kind of last comments to the Marshallese community, which can be done if you'd like both Marshallese in English or strictly in Marshallese is fine.
Amy, you want to say anything?
I'm here. Yes, I wanted to see if Dr. Riklon can, if I know that I saw the last email and the CDC report, just a little overview of it, a brief overview by Inamanan Par Milale Community NAD.
Kuar kanan pa in just kanan kaga chirik kata.
Kan
Okay. Aman kumol. Ngay kumo je jalo kumo je ronga jake mani kime mi jalak palen lo alang ni kar June July o lo alang ng chamargo ki arjo June team jen CDC. Eleganan kar Arkansas Department of Health kachidak nga ramarong ni dokum kamana kita ya Katak ilo Arkansas. Elo tada lo Northwest Arkansas ejelete kit remajo ko ba romatar Spanish room. Ikian kanan ke ilo yene o yabana ka lukun lang case. Ba lang case ko me archela de kit yimir. Elo tada rome ra cherbalo manpao. Team na ara dokum cherbaliper in Hispanic community cherbalipen Raiwan Ejmur. Kamana ka da kiloan ng bago, yung kamana focus group ang kanani panilang yan. Railo chukuchukum perin ko ba, chori krikarom, rutaro alo, rutorom, manchargom, rojat. Yung chichuyan ng bago miyar, chidang lang na imigin report in ay kali karagay. Ilokar alang ka na may kanonogaga, chunum chulayo. Nambayo may, yapayan, kapro mo yung ngan kajimen. Jadi nambago ngan Rome ilang yan kijin karchiladir harar pagnang namin COVID-19. Rome ra relang lawan hospital ilo chukudu kumperin Rome ra chago ilo chukudu kumperin. Kargan nambagin menga ilang lo nambago lo pen ro charan matalo Hispanic community yo. Kali karage kajermajo kargan chongan nambana yar chongan lengaga iya tanayar. Bayang labalokan gar kijin chiladalok kich chen ilang yan race gojat ak ethnic group gojat agar rojat balalain eka wadadalok aga ibirurolok aga ilang lok case iper ya karangan chongan ng bayawar ilang yar rarel kimi ilang yar ya bayar ka radnang na miyam rad chagojan norin karangan ng bago italaga kay karangan reporto ro ba ilo Northwest Arkansas in chongan population na yar compare ng all pen population na yan rojet na total population of Northwest Arkansas rumaja right comprise right pagot 1.11 lang ang 2% in population in Northwest Arkansas pada romerar chawojan norin arki chongan may chongorale de pajan ngi keme medalo Melalain mengekit 1.11% in population in pada ekebak chongorale de pajan in gar mediko pajar remajo agar worchuan yena me longan chamarinot iden chimatan ga dalang lagun chimatan en romerar melo Northwest Arkansas echen remajo mana ba miar kalok jadi anam bago ya kini mikali karge kar kicu tu kia menjana kar walal tak oleh ben nambah kana yareng agar walal tak yang cuman nambah na active cases yang cuman population na yang lukun work cuman yang komunikasi lolo per Facebook rekan nanan kejung iten oleh beran iten oleh week ya work kicu rojan cukup perin cara namataram kijala kacir rajar cakuyan murin ceno tenang namanya nambah kena yareng karangan nambah ko kita kata lo rane mo dalok yang nelo ratum jon rane o elo ko nemmal lo nambah imecam melalain ba ijin pajar melalain yammal lo kena ilang yar ci lore kagene ko ini coba ko jon pajar ilang yar ki roji cara beli pen rain cara rematar jan Raiwan Ejmur UAMS yang caga ci me roj call ki jen contact trace kali karangan yar unro reko nya isolate unro reko in quarantine unro reko ba ko itu tak yang ngecene lori menagain pe ne manot ene malok chago nambagana per ya ko chego chin chap pajarat ya ko lukun meje ka rom jojo ka jabaro ko mi rabbit yod mi again mo reka again ike chenar kolpe na ora bien ka jabal hand sanitizer ho nge chalo ko ren lo war meje ole bien nge ko tan ngan tan chicken tera balam ko joy pensione o me e chep chugelo kabi chukune ni nam kono bar meje ne na bar meje ilo am ka cheon katolo ko chino ne molte jaba e chamma da meni ba chit katolo ke chendron pada mana de uin ba jen ka jabaro pamle om ke jen ka jabaro rotoro war ilo war lor empo ba ka geno ya mi mena ge ne la bana ro ko mi chit ka molo li ro jo be emman nam ba ge lawan wigin chit charam ka jadar ge be ene jentri na ne amalo lawan week kana do mal nan kana do yekkelo go gain ge kan ge am jan chino chugul kan ge am jan kia tan chino flu season ne em kan ge ti lo ga nam ba kan lo kan so in e chaba mal lo ga ke jilamo em ye jam mewru rut kijin em ke ju ja within chappa ta lore ka ge ni go ta go me kian rana ne mewru ja ba cdc ja ba ka che kan lore wa wen ge no tamagam kajere palen ye wa takita ko ani mi aga yorta jabro da ko ibar monana no par kala balog ngai jablu kun mala la ko mol emi ko mol ganam le dok kirkian
Mol tada kana magar kala balang melele go yar le jabi mol.
Well, thank you both, Amy and Dr. Riklon, for sharing. Amy specifically for presenting all the information that you presented to our Marshallese community members, and Dr. Riklon also for providing kind of support to additional questions that I had. And so thank you so much for you both. Thank you for those who participated through Facebook Live and those who participated through Zoom. We're going to continue having virtual programs like this in Spanish and in Marshallese. So if you don't already like our Facebook page, I'd say go give us a like, so that way we can, sorry, I have a dog here in the background. Give us a like so you can be following along to similar programs like this. If you weren't able to, if you want to rewatch this, we'll have it recorded as well through our YouTube, and we'll provide that link as well. So thank you so much. I hope you all have a good night.
Thank you very much, Diana. Mol tada tada.
Thank you.
enjoy have a good night